Spondylolisthesis. Spondylolisthesis is a fracture of pedicle or pars interarticularis. And next term is spondylolisthesis. The spondylolisthesis is slippage of one vertebral body over another body. So this is here you can see that spondylolisthesis. So spondylolisthesis is slippage of one vertebral body over another body. That is spondylolisthesis. And lastly, the spondylitis is it is inflammation of paraspinal and inflammation which causes paraspinal muscle spasm, and its treatment is also muscle relaxants. So till now I have discussed few terminologies. Now I will discuss about most common spinal or skull trauma. Most common mode of spinal trauma in developing nation is fall from height, and in developed nation it is road traffic accident. And most common mechanism of the spinal trauma is flexion. Retraction is more than flexion. Worst mechanism of the spinal trauma is translation more than flexion rotation. Most common site of spinal trauma is cervical spine. Cervical spine is most common site of spinal trauma. Most common site of spinal fracture is lower thoracic spine, and if you consider spinal fracture, it is lower thoracic spine. Then most common site of cervical cord injury is cervical spine, and most common site of skull bone fracture is temporal bone. And most common site of skull bone fracture is temporal bone, and most common site of facial bone fracture is nasal bone. Most common site of facial bone fracture is nasal bone. Most common site of the mandible fracture is neck of the condyle. Now few eponymous fracture. First is Jefferson's fracture. Jefferson fracture means this is worst fracture of ring of C1 vertebrae. 80% of patient doesn't have any neurological deficits. So this is fracture of atlas bone. Now I will discuss about hangman's fracture, and this is the hangman's fracture. Fracture of pedicles or pars interarticularis of C2 vertebra. Spondylolysis of C2 is the cause with spondylolisthesis of C2 over C3. Spondylolysis of C2 with spondylolisthesis of C2 over C3. So spondylolysis is fracture of the pedicle or pars interarticularis, and spondylolisthesis is slippage of one vertebral body to another vertebral body. Now I will discuss about undertaker's fracture. That is fracture subluxation of lower cervical spine. Subluxation of the lower cervical spine with C6, C7 intervertebral disc disruption. C6, C7 intervertebral disc disruption. And this is post-mortem finding. And then Clay-Sovelos fracture, that is avulsion fracture of tip of spinous process C7 is affected more than T1. 7 cervical vertebrae is affected more than T1. So that is Clay-Sovelos fracture, avulsion fracture of tip of spinous process. So you can see clearly here fracture of tip of spinous process in Clay-Sovelos fracture. So chance fracture, seatbelt injury or jackknife injury. The mechanism of first is flexion, then followed by flexion rotation of the vertebra, and the level of injury is at the junction of T11 and L1, that is 11 thoracic vertebra and first lumbar vertebra. Here road traffic accident or head-on collision. In road traffic accident or head-on collision, this horizontal fracture line running across all three columns of spine, including the spinal cord. So this will ultimately cause paraplegia. So this horizontal fracture line running across all three columns of spine, including spinal cord, and that will cause paraplegia. In this respect, we will discuss about Dennis 3-column concept of spinal stability. And the components are, first is anterior columns, which includes anterior longitudinal ligament plus anterior 2/3 of vertebral body and intervertebral disc. Then middle column, which include posterior 1/3 vertebral body, posterior 1/3 of IV disc plus posterior longitudinal ligament. And lastly, posterior column. Posterior column consists of posterior ligament complex and neural arch. Neural arch means pedicle transverse process, and lastly superior articular process and inferior articular process and lamina, that is spinous process. So this is the components of spinal column, and this is called Dennis 3-column concept of spinal stability. Then after discussing chance fracture, and lastly the keyword of fracture, that is mother will present less than 8-year child suffered from road traffic accident. There will be no reflexes, but X-ray is normal. No radiological abnormality is found. An investigation of choice is only MRI. Spinal cord injury without radiographic abnormality, that is the SCIORA. So here first flexion occurs, then extension, and as a result spinal cord not recoils, and this causes injury. Spinal cord not recoils in rapid movement from flexion to extension, and this will cause injury. And in children, posterior column is elastic. Symptoms will be blood pressure will be low, hypotension, pulse will be low, bradycardia. Young male, road traffic accident, unconscious, neurogenic or spinal shock, loss of sympathetic flow. Most common site is lower cervical cord spinal injury. Now spinal cord injury may be complete or incomplete. Investigation of choice is MRI. If there is sacral sparing, that means sacral sparing present, that means it is incomplete spinal cord injury. Here perianal sensation also present, rectal motor tone is present, and bulbocavernous reflex is present. But if sacral sparing is absent, that means spinal cord injury is complete. Here perianal sensation, rectal motor tone and bulbocavernous reflex are also absent, and and bulbocavernous reflex is last reflex to disappear and first to reappear in a patient of spinal shock. So hope this will help. This is all about spinal cord trauma and spinal cord fractures. Please like my channel Prefrontal Cortex, subscribe my channel Prefrontal Cortex and like this video.